Hi everyone, today is Thursday, August 20th. It's Dr. Wendy Fortna here with an update. First and foremost, thank you for your patience. We've had a lot of people off on vacation over the last few weeks and I will be off for a short period, and so the videos are a little bit sparse in frequency. But certainly if there is information to communicate to you, I will make sure that it gets out there in some form or fashion. So as of today, we have no active cases of COVID-19 in special areas or in our hospital, which is really nice for people. All 4 of your physicians are healthy and attending patients, and all of our nursing staff as well is in excellent health. So not a lot of updates today. I received one question which is a little bit delayed. I'm sorry for the answer just because of the absence. Wondering about people who work in other people's homes. What kind of precautions should they be taking? So this might be someone who does a cleaning service in other people's homes, who does pet sitting in another home, or even people who are babysitting. So if you are going into someone else's home, I presume that you are healthy, that you are feeling well that day, and that the members who may be in that home are also feeling well. If you are going to be within 6 feet of those individuals during the service provided, you should be wearing a mask. If it's at all possible to stay 6 feet or further away, then you certainly don't have to wear a mask when you're performing that service. You would presume that any surface you contacted in someone else's home, if they are not part of your cohort, could potentially be a contaminant for any sort of infection, and just make sure that you very thoroughly wash your hands before touching your face and again upon leaving that facility. When people are talking about babysitting, that's a little bit more difficult because I presume that the person providing the service has to be within 6 feet and likely cannot wear a mask, nor could the children that you're taking care of. So you would want to make sure that you are part of that family cohort with those individuals or intend to be so moving forward. Then you could actively care for children in the home without concern about masks and contamination of yourself or them. If you have further questions about that, please don't hesitate to look online or to contact one of your healthcare providers. We are continuing with the scheduled lab appointments up here at the Hanna Hospital, and x-rays are still offered Monday through Friday on a walk-in basis if you have one of those requisitions. Please make sure you are either using the website or the 1-800 number to book those appointments so you don't come all the way to Hanna only to be turned away at the door. We are not accepting walk-ins right now for lab services. A number of you have been making use of the new visiting policies in the long-term care, and we would like to remind people that when you are visiting in a rural community, you may know the neighbor of the individual you're visiting, or you may recognize other people in the nursing home. Please remember that you are there to visit your loved one, and we would like to keep everyone in their separate areas when they are visitors. Our residents, by the very nature of their illnesses and ages, mingle among themselves, but we really don't want visitors seeing multiple residents. We can't track that all that well, and we remind you to also continue wearing your mask the entire time that you are in the facility, including in your loved one's room. You'll notice that all of the healthcare workers are wearing a mask from the time that they check into the facility until they leave, and we'd like you to do the same, please, in order to protect all the vulnerable individuals in our hospital. A lot of you are getting nervous as the school year is coming up and you're not quite sure maybe what you're going to do for you or your family. And I'm grateful that the Prairie Land School Division has offered so many opportunities to our students. We have had inquiries here at the clinic about those individuals with pre-existing conditions, specifically children with asthma and allergies, and where they can go to get a COVID-19 test when they are symptom-free. And the answer is unfortunately not here in Hanna. We are not able to offer that service at this time. You need to go on through 811, or better yet, through Alberta Health Services. There are links, and you can book an asymptomatic COVID test in one of the surrounding centers. They are of course available in Drumheller, in Stettler, and in Red Deer, as well as the larger cities if you happen to be traveling for any back to school shopping. If you are uncertain whether you are at increased risk of COVID and you're trying to make some decisions about where to send your child, that's certainly a conversation that you can have with your family physician. I've had a few people asking me, can my child with asthma wear a mask? And the answer is absolutely yes. If your child is having difficulties wearing a mask and you feel like their asthma symptoms are exacerbated, it probably means that their asthma is not under good control, and they should definitely have a visit with their family doctor to talk about the control of those symptoms. I will say that some homemade cloth masks can be very thick, and those can be harder to breathe through. People who feel a kind of a sense of claustrophobic may want to be wearing one of the disposable masks more often, or the thinner material masks, rather than the cloth masks. You should be experimenting before your child goes back to school if they are one of those age groups that are required to wear masks in the hallways or in common areas. A good opportunity to do this is when your child is engaged in something they really like, such as screen time or iPad time. That's a great opportunity for them to get used to the feel and breathing through a mask. I think that's really all that I have time for today, and I don't have a lot of updates. As I said before, I'll be back to give you more information if things change. Otherwise, I'll do a routine video for you in early September. Have a wonderful day.